Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication known as Pramipexole. Its brand name is Mirapex. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Pramipexole is a dopamine agonist whose mechanism of action is not completely understood. Its action is believed to be related to its ability to stimulate dopamine receptors in the striatum. In terms of indications for use, Pramipexole is indicated to be used in the treatment of Parkinson's Disease. It can be used for moderate to severe restless leg syndrome. And there's an off-label indication to use this medication to treat depression. Now, before somebody was to use Pramipexole, there are some precautions and warnings that they should be made aware of. Orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position, could happen with the use of Pramipexole, especially when the dose is being increased. Abrupt discontinuation of Pramipexole has been associated with hyperpyrexia, or a very high fever, as well as confusion. Rhabdomyolysis has been reported with the use of this medication. And falling asleep during activities of daily living can also occur with the use of Pramipexole. Restless leg syndrome rebound has been reported. And compulsive behaviors such as urges to gamble, increased sexual urges, and urges to spend money has been reported. Hallucinations may occur with the use of Pramipexole, and the risk would increase with age. Renal or kidney impairment may increase the risk of toxicity. And the use of this medication is not recommended in severe renal impairment, so a creatinine clearance less than 30 mL per min. Once somebody is made aware of the precautions and warnings and they start to use Pramipexole, they can expect to receive their dose orally. If somebody is using Pramipexole to treat Parkinson's disease, they can expect to start off with 0.125 milligrams 3 times daily. The dose can be increased every 5 or 7 days for about 7 weeks to reach optimal therapy. The maintenance dose usually falls between 0.5 and 1.5 milligrams taken 3 times daily with or without levodopa. If somebody is using Pramipexole to treat moderate to severe restless leg syndrome, they would typically use 0.125 milligrams about 2 or 3 hours before bedtime. The dose can be increased every 4 to 7 days, and the dose for this treatment would typically not exceed 0.5 milligrams daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using Pramipexole, so I'll go over some of those here now. I mentioned the risk of orthostatic hypotension. This can happen in up to 53% of patients. Up to 14% may experience constipation. And nausea may happen up to 28% of the time. 10% of patients may experience confusion, and up to 28% may experience dizziness. Dyskinesias may happen between 20 and 47% of the time, and up to 16% of patients may experience a headache. Insomnia can happen just over 25% of the time, and up to 36% of patients may experience somnolence. Hallucinations can happen 5 to 17% of the time. Now, some more rare but serious side effects would be heart failure, the emergence of a psychotic disorder, or neuroleptic malignant syndrome. That's all we're going to talk about today with Pramipexole. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.